like the CDC does, but we don't think there's quite enough evidence yet to require it for school entry. That's the latest news from the Michigan Senate, and of course all states are handling this in different ways, but I think we are consistent where most of the medical evidence is now, that it's a good thing, you ought to have it, but the long-term studies aren't back yet to make it mandatory. There's some other issues too. I think the herd immunity question is a good one, because if you want herd immunity, you would also have to immunize the men.
Right.
And so, maybe someday.
It's in trials right now for men if it's going to be approved, so that will be.
And actually, it's been licensed for use in Europe for men.
So we'll have more data on that in the future. So
forward.
Stay tuned. Are there other vaccines coming out we should be aware of? Do you see any other changes in the?
I think there's an awful lot in the pipeline, but I don't know if we can handle more right away. There have been so many. I'm saying that tongue-in-cheek, but there have been so many new changes to vaccines in the last year. We think about the ones that have been licensed, like rotavirus or meningococcal conjugate vaccine, or the new pertussis vaccine we talked about. All these vaccines have really put some complexity, or a Zostavax, a new zoster vaccine against shingles. Those are all within the last year and a half, and it's been a lot. There are more that are in the pipeline. I don't know exactly what they are. There's a new combination vaccine that we hope to see in the next couple of months. It's going to combine a bunch of the vaccines into one shot.
Oh,
that'll be real handy.
Sure. And some of these must just be recommended for certain populations that are at risk. They're not necessarily recommended for everyone.
Most of them are pretty population-based, but they may have age restrictions. Things like the rotavirus vaccine is only for small infants. The meningococcal vaccine, the highest risk really they've found are college freshmen living in dorms, but they've gone back and said, but let's get the adolescents before they go to college. Let's look at it for 11 to 12-year-olds and even possibly through adolescents. And so that would be just a one dose that we would do for that. The Zostavax is only licensed for 60 years and older. So that's going to, the shingles vaccine. So most of them are age restrictions, not necessarily risk restrictions on them.
Too bad we don't have a vaccine for cardiovascular disease, stroke, diabetes, high blood pressure, and high cholesterol. That would make your job easier,
that would
wouldn't
make
it?
it easier. Although, some people talk about, diet and exercise could be considered a vaccine, as a preventable thing for some of these chronic diseases.
Well, maybe we should just take a couple minutes, Dr. Holzman, and maybe just have you say a couple words about Michigan's overall public health, situation. Obviously, immunizations are part of the picture, but you have a bigger role than that, and of course the leading cause of death in Michigan is cardiovascular disease, and there are some controllable factors. There's no vaccine yet, but there are things we should be doing, right?
Yes, definitely. And if you look at a lot of the leading causes of death, whether it be cardiovascular disease, certain types of cancers, stroke, diabetes, these things, a lot of them have behavioral aspects such as diet and exercise, to keep the weight in a reasonable range, to eat your fruits and vegetables that brings in certain vitamins and nutrition. Those aspects all have an effect on healthy living. And sometimes I think we get too caught up on the exact recommendations of I have to lose 150 pounds to get things, but just to take it slowly in steps, to start saying, I want to work towards these goals and set some realistic goals for yourself and move forward on trying to live a healthier life. And I think we all need to put that in. I know I do.
If somebody is watching this and they're a smoker and they think, I know I need to quit, but I need a little help, what should they do? What would be the first step they should do?
One is we have a great quit line. Free quit line for them to call in on, the Michigan Quit Line, which you can get that off of the website. And I should know the number right offhand.
We can put the number on the screen.
I'm almost positive I know it off the top of my head, but I don't want to misquote it.
So if you call the Quit Line, and what are they going to tell you?
You're going to get a trained counselor there, which will start to put a program together to help you quit smoking. And depending on what background you're coming from as far as insurance and everything else that goes along with it, you may be eligible for some free nicotine replacement therapy. They also might send you off to your own insurance company that has their own programs, because some of the different insurance companies within Michigan have their own programs. So that's one thing. The other thing, talk to your healthcare provider. A lot of times we talk about tobacco and looking at it as a chronic disease. Sometimes it takes people a few different times to quit, and to keep working with them on looking at ways to help them quit, because it is very addictive, and it's not simple for some people just to stop. So we need to have passion for those people who smoke. Most smokers do want to quit. So we need to have passion for them and help them through that process.
So the state operates a quit line that they can call. We have an immunization program if you don't have insurance for your children, and you can find out about that hopefully through your pediatrician's office. If you don't have a doctor, through your county health department.
Exactly. They're a great resource.
We only have a couple more minutes left, gentlemen. Is there anything else the people in Kalamazoo should know about Immunization Awareness Month?
I think it's real important for them to take, although MICR, our registry, does a great job of keeping the information, it's real important to keep that information yourself too, and try and keep a track of what immunizations your child has had and the immunizations that you've had, to take responsibility and be able to carry that to wherever you go. We hope that they'll stay in Michigan, but if they happen to move to another state, that they have that information, because not only is it expensive, but as you get extra immunizations, every shot is beneficial, but we don't want to overdo it.
Sure. Okay, so you should keep your own records in case you leave the state and your doctor doesn't know how or have access
right.
to.
Or if you ever do travel outside of
Yep.
the country, a lot of times you need that information.
Bob,
I think one of
anything else?
this may not be necessarily related to August and awareness, but something that I think is missed a lot here in Michigan is just making sure that you've gotten your flu shot. Last year, millions of doses of flu vaccine were thrown away. There just weren't enough people that wanted the vaccine.
Should everybody get a flu shot?
Everybody can get a flu shot. CDC has not yet made it a universal recommendation for all individuals, but anybody who wants it should be able to get it if they go to their physician's office, and I would strongly encourage people to do that. There's different types of flu vaccine, and we've got a long ways to go to stop the 36,000 deaths a year annually across the country. And I think that we can make some progress at that by trying to assure that people are vaccinated, and specifically target those that are 6 months through 5 years of age. Make sure that those kids get vaccinated, and then any adults get vaccinated
So
as well.
small children are at risk, and elderly people, but anyone can have it and may benefit
Correct.
from a flu vaccine.
Absolutely.
Bob Swanson, Dr. Greg Holtzman, thanks for being on my program, Current Events. Stay tuned next month. I'll bring you another show from the state capitol. This is Tom George, your state senator, signing off.
Thank you.
Thank you.